Continuing Mobile Education for Emergency Medical Services Providers. Episode 2, I Don't Understand You, Aphasia in the Field. At the end of this episode, you should be able to define aphasia, understand the two main types of aphasia, and learn strategies to improve communicating with the aphasic patient.
Aphasia is a condition in which there's difficulty in a patient's language. Now, aphasia can be both on an expressive side in terms of individuals being able to verbalize and talk, and it can also be a receptive aphasia, meaning that patients have a difficult time receiving language and being able to process that information as well. In either case, it's affecting that person's ability to communicate. So even if an individual is able to hear clearly and be able to process some of the information, it may be difficult for them to adequately express that in a verbal way, to be able to encompass everything that they're experiencing, or to be able to answer questions in the degree of thoroughness that they would otherwise. Aphasia is common in patients who have had stroke, particularly affecting the language areas of the brain.
Aphasia is defined as the impaired or absent comprehension or production of or communication by speech, reading, writing, or signs caused by an acquired lesion of the dominant cerebral hemisphere. In other words, aphasia is the acquired inability to produce or receive language due to a brain injury.
Well, aphasic patients are commonly found in the field, particularly when they're a victim of a stroke in particular. So there are lots of medical conditions that can certainly cause that. Again, it makes it very, very challenging to obtain a history. And so from that perspective, there are definitely some key things that you can do to help your ability to communicate. For most aphasic patients, it's not that they have no cognition. They have not lost the ability to understand what you're saying or hear what you're saying. And so that simply means that you need to use alternative communication means. It means that you need to ask more yes-no questions instead of open-ended questions, and articulate to them, please shake your head yes or no for specific questions. Are you having chest pain? Are you having shortness of breath? Rather than our usual questions when we approach a patient, which is, so what can I do for you today? Or what made you call 911 today? Asking much more yes-no questions so that they can articulate in other mannerisms their answers to those questions when they can't speak.
I think what's particularly important for patients with aphasia is that any types of questions that are asked of that person should be as simple as possible and not require a long, extensive response to them. Yes-no questions can be useful, but particularly you have to make sure that a patient is consistent in terms of answering them. But even individuals with fairly what we call dense aphasia, those not able really to speak, can still communicate with regards to a yes or no answer to many questions. So I think my advice would be to try to keep the complexity in the language as simple as possible so that it's less of a burden on the patient that may have difficulties with speech to begin with. Once you establish that the patient is adequately hearing you, can answer some of these questions, then it's likely aphasia is a consideration, that they're really just having problems with the generation of language or reception of some of the language. It's not necessarily a hearing type of issue. And that's simple. The yes or no questions can begin to tease that out for you and help facilitate that communication. The key that you want to do with a patient with aphasia is not to increase their frustration. They're already frustrated that they can't adequately communicate. So just a little bit of some patience, trying to rephrase some questions and trying to get at the heart of exactly what's going on with them really goes a long way.
Some communication tips are, make sure the patient can hear you, try and use yes or no questions, be patient and creative, and understand the patient may be frustrated.
Sure. So some of the strategies that we can employ when speaking to an aphasic patient, first off, ask yes/no questions. That way they can respond typically by head motion. If they're unable to move their head, a lot of times I'll have them thumb up, thumb down, okay, signs and other things, one finger, two fingers, those different ways to articulate yes/no answers to yes/no questions that you ask. The second is, again, it depends on the medical reason for them being aphasic, as to a lot of times these folks can write. So that's why it's always nice to have a pad of paper on you and a pen so that they can write answers, again, yes, no, or you yourself on a piece of paper, write a yes, write a no, have the patient point to each answer. Becomes a much easier way to help communicate and get information from these individuals.
Some communication tips. Look for responsive gestures, use visual cues, and understand the patient may be able to write.
Yeah, particularly for patients that really have profound deficits in their language communication, those patients with a dense aphasia that are not able to speak with you. There's other kind of ways that you may have to be creative in terms of that communication. Oftentimes, sort of nonverbal cues of communication, pointing to particular areas that may be causing them some concern or problems. Some patients that may not be able to speak may actually be able to write and be able to put down some of their information, their thoughts on paper. Again, this is going to take some creative thinking at times and a little bit of time and patience to be able to get that information, but it's time well spent, because if you can get that direct information from the patient, either through nonverbal communication, using pictures and writing, that's can really supplement their ability to engage in conversation and provide some information that may be valuable.
Some additional communication tips. Be creative. Don't rush. Be patient. And use visual cues.
I think that the take-home point for patients with aphasia is to have patience and to also try to engage that patient first. Before going on to other caregivers or family members, try to get as much information, engage them in the conversation. You may quickly realize what the limits to that are, but then certainly include them still in the discussion if you're talking with other individuals that may be on the scene as well.
Now that you've finished this episode, you should be able to define aphasia, understand the two main types of aphasia, and explain some strategies to improve communicating with the aphasic patient.